Good morning. I'm Martha Coakley, Attorney General of Massachusetts, and I'm pleased to have with me this morning several supporters of the no on question 2. We will introduce them in turn, but with me today are Somerville Mayor Joseph Curtatone, Somerville School Superintendent Tony Pierantozzi, Cape and Islands District Attorney Michael O'Keefe, Dr. Bertha Madras, Ray Tomasi, and Judge Joseph Reardon, retired. I'd like to speak briefly first that personally and as Attorney General, I'm very concerned about what I feel has been misleading and a misunderstanding of what this question is about. Let me just start with a few anecdotes. About a year and a half ago, when he was drunk and high, a young man crashed his automobile into a home in Arlington. He killed his best friend who was in the passenger seat, who was sober. He survived to plead guilty to motor vehicle homicide. A few weeks ago, a young woman at an after a football game party who was intoxicated wandered away from her group and ended up dead because she drowned. That is still under investigation, but what we know, at least from preliminary facts, is that a young woman under the influence, at least of alcohol, is now deceased. Those are only two episodes that those of us who work with children, both in diagnosing, treating them in our schools, in our law enforcement, see day in, day out. They're not all fatal, but many of them have equally damaging consequences when young people particularly get involved in substances that are dangerous to them, to their emotional health and to their physical health, and indeed to others. Does anyone think we won't have more instances of those kinds of tragic events? We see enough as it is, and we are convinced that having easier access to use marijuana is not the correct message to send to our young people. We believe there will be increased pressure on individual students to use it, and there'll be fewer sanctions, real or actual, to make sure that they do not engage in using illegal substances now. I think that it's disingenuous to think that this question is anything other than a legalization of marijuana, although civil fines are still to be in effect. The scheme that's been proposed in this question makes it relatively impossible to enforce. Police will have to give out tickets. There's no way, and I frankly think in this economy, there's no way we're going to fund a registry of marijuana smokers, a way to enforce those tickets, a way to collect the money. And so as a practical matter, voters should not be fooled that this is anything other than a legalization of the use of marijuana. Particularly about question 2 and children. The message that it sends to our kids is completely unfortunate. Although those who support this proposal have framed it as a way to prevent young people from having their futures tarred by criminal records that they don't deserve or need, the truth is that that rarely, if ever, happens. I believe that the framers of this question have created a problem and then proposed this solution, which in fact has greater detriment to particularly our youth and to others who suffer with substance abuse. It's not just those of us who are in law enforcement who are concerned. We have today professionals on the front lines who work with children, particularly children who have substance abuse problems, all of whom agree that question 2 is bad for our children in the Commonwealth. Clergy members across the Commonwealth this week expressed their grave concern about the impact on youth if question 2 were to pass. And frankly, when you look at newspapers across this Commonwealth, many of them, when they understand the issue, agree with us that voters should vote no on question 2. Many parents who are going to go to the polls on Tuesday think there's no harm because they may have smoked pot when they were younger. Today's marijuana is engineered for potency. The cigarettes, the marijuana that our children are using is not your mother's marijuana, and it's in general 9 times stronger than what was used in the 60s and 70s. In Massachusetts, we know that marijuana is the primary cause for adolescent inpatient substance abuse treatment. In 2004, our most recent year available, the average age of adolescent admissions for substance abuse treatment was 16 years. For 56% of these teenagers, marijuana was the primary drug for which they were being treated. Alcohol was a distant second at 27%. And ironically, Although we certainly agree we have a substance abuse issue with alcohol, not only in some instances is marijuana easier to obtain, it certainly will be easier to obtain than alcohol. And for our younger kids, younger high school and middle-aged kids, it will be easier to obtain and use marijuana without consequences than it is for alcohol. That in some ways makes it the gateway drug for alcohol and substance abuse, which we know is a continuing problem in our schools and in our communities. We know, particularly when it comes to mental health, that teens will self-medicate. Marijuana can worsen depression, it can lead to more serious mental health disorders, and it can mask the symptoms of depression or make depression worse. Marijuana is a checkout drug. It does not allow for appropriate diagnosis or treatment of serious emotional and mental health disorders that so badly need attention, and that we have frankly failed our children and will continue to do so if we pass this law. Marijuana use can lead to schizophrenia, anxiety, suicidal thoughts, and depressed teens are also twice as likely as their peers to use marijuana. Teens who smoke marijuana at least once a month are 3 times more likely to have suicidal thoughts. It's important for parents to understand that the current criminal justice system is the largest single source of referral to drug treatment programs. I know from my experience, the police who work with kids know this, DA O'Keefe knows this, that often the only way that we can recognize and get a child who has a serious substance abuse problem into a system that can help them is through the courts, not because we're trying to impose a criminal record on them, but because it's the only way to get their attention and frankly their parents' attention. Those offenders rarely, if ever, get a conviction as first-time offenders, but they do get into a system where, unlike the proposal in this question, there are resources in probation and funding for treatment when a court and parents feel that it should be mandated. This question strips away all of that system. There will be no available help or any way to use either carrots or sticks, particularly for young people who use marijuana and develop a substance abuse problem. Who's going to oversee and pay for this grand new system? Not in this economy. It's not going to happen. So we ask that those who consider what they should do on question 2 to make sure they know that this is not so much about protecting our youth. It's really about leaving our youth exposed to greater risk, greater use of marijuana, and that we hope that people will be adults when they vote on this and they will vote no on question 2. I'm happy to introduce now Mayor Joseph Curtatone of Somerville. I know that he feels strongly from his own work in the community, in particular as mayor, that a no vote on question 2 is the wise vote. Mayor?
Thank you, Madam Attorney General. I want to say welcome. It's an honor to be here to stand with our top law enforcement official, the Attorney General of the Commonwealth, Martha Coakley. She's been a great advocate and partner with cities and towns, first as Middlesex County District Attorney, and now as the Attorney General. I'm also here proud to be standing with members of the District Attorneys Association. I know Jerry Leone, our DA, is represented here today, as well as DA O'Keefe. And I spoke with them jointly at a recent press conference on Beacon Hill. And I do so from a few different perspectives. First, I'm the mayor of the most densely populated city in New England. We are racially diverse. We speak 52 languages from more than 20 different countries. The racial and ethnic minorities and the poor populations, the urban centers, would be the most susceptible and the most at risk when you make this drug more readily available in our neighborhoods. The only ones that are going to benefit are the drug dealers and crime organizations such as organized street gangs. That is something we've been working diligently with the DA's office and the Attorney General to eradicate out of our community. And this question, if passed, flies against every effort of prevention, intervention, and education. And what we've shown here with our efforts with law enforcement officials and the community, we've made great strides. When I took office back in 2004, we were faced with an immense crisis. OxyContin and opiate abuse was at an incredible high level. Suicide among youth was alarming. Any one suicide is alarming. We had several at a time directly connected as a consequence of OxyContin opiate abuse. And what we know is that they didn't start with those heroin byproducts. They started with gateway drugs such as inhalers, alcohol, and marijuana, which led to more consequential actions and choices. But working together as partners, we've had a real positive effect. Our health surveys since among our youth and our students have shown that fewer youth in this city have been choosing to use illegal substances and drugs, which can have a consequential health effect.